Welcome to Parent Solution. Today we have here with us Dr. Mark Bertin. Welcome, Dr. Mark.
It's great to be here. How are you?
I'm fine. Thank you so much. Dr. Mark Bertin is a developmental pediatrician, author of many books, and he's also an assistant professor at New York Medical College. Today he's going to tell us more about children dealing with ADHD, how to collaborate with them. So my first question to him is what exactly is ADHD? Like every second parent is scared whether my child has an ADHD. So can you just tell us what exactly is ADHD?
Well, I think the best way to understand ADHD is as a developmental disorder, actually. I think that helps
Okay.
really understand best how to both evaluate for it, know if it's going on, and also how to support kids if they have it. So our understanding of ADHD nowadays basically regards ADHD as a delay in a very wide-ranging skill set called executive function, which are like your self-management skills. So some children, for example, are behind in language skills, so then we would call that a language delay. You can have motor delays, like difficulty with walking and running and skills like that. So if you have ADHD, in spite of the way it's often talked about, it's, very well-defined medical disorder in which you're behind in these self-management skills. So that means it's a little bigger than most people anticipate. ADHD has an aspect of it that has to do with attention and behavior, but also as kids get older, involves organization, planning, time management, emotion. It's almost like you can shorthand it that anything that requires management requires executive function in life. You have to manage projects, you have to manage emotions, you have to manage all these different parts of life. It's like the brain CEO.
Okay.
Yeah. So, the short of it is like anything else developmental. There's two things to know. One is that skills grow over time. So part of understanding if someone has ADHD is comparing their development to same age peers. Children who are younger aren't supposed to have a lot of ability to manage time or to organize or plan. And the shorthand of just understanding the difference between typical development and who might have ADHD, I think basically comes down to the fact that part of the diagnosis of ADHD includes the word impairment, meaning that not only are you struggling with these self-management skills, but you're struggling with them enough that they're causing you chronic difficulty. And I think that's the easiest shorthand to understanding, why kids should be kids, kids will change over time, kids will grow out of some things. And, if you're within the range of typical development, you shouldn't be causing yourself a chronic problem.
Okay. Well, okay. There's a very common question among parents, like, can we use medicine with children having ADHD?
Well, when you look at how to support children with ADHD, I think it's a very multifaceted approach that supports children with ADHD. So your question was about medication, but I think it's important to put that in context. So when you're looking to support someone with ADHD, the first thing that's most important, I think, is to just understand that it is a skill set that's behind. It's not a choice. And that's subtler than it seems. Like forgetfulness is, a symptom of ADHD. You can't encourage someone to be less forgetful just by marking their grades down constantly, because it's not that they're choosing to be forgetful. They need an intervention that's going to help them learn how to be less forgetful. Same thing goes for impulsiveness. Same thing goes for many, many other parts of ADHD. And the reason I think it's important to sort of pause and describe that before talking about the medication is I think people are often scared of even diagnosing ADHD because they think the diagnosis
Yeah.
directly relates to medication, and it doesn't initially. The most important thing is if you really want to support anybody, any child in life who's struggling is trying to define why are they struggling? Why are they behind? And so just understanding ADHD alone is the beginning of the intervention when you realize that somebody who's not listening when you ask them to do things may not be following through simply because they're distracted or because they're impulsive and not because, they're intentionally being difficult. So the interventions for ADHD tend to be very complicated. Um, when it comes to early childhood interventions, most of the recommended interventions initially are educational and behavioral. There's not a lot of downside to them. So you're trying to teach parents how to help manage kids with ADHD. They're trying to teach children with ADHD how to develop better executive function skills just through sort of a whole slew of non-medical interventions. And that is always helpful. The question I think comes up a lot, I mean, through observation of if it's going to be helpful enough. And then when it comes to ADHD medication, I think it's really unfair to parents how they're often portrayed. The way I try to summarize medications for ADHD is that no one should use medications for anything in life they don't need. But really, when you look at the research, ADHD medications are no better or worse than anything else being used in pediatrics as long as they're used appropriately. So ADHD medications have been around almost a century at this point, in spite of how they're talked about online. If they're managed well, about 80 to 90% of people can use them without significant side effects.
Okay.
Many of the misperceptions online have been pretty thoroughly disproven, including the fact that they're not dependency causing in people with ADHD if they're used appropriately. So they actually cut down on the risk of substance abuse. That's one example of many side effects people are concerned about. And the research is pretty clear that most people with ADHD get more. It's more. It's not that they need only the medications, but they get more from the medications than any other individual intervention. I always think about the interventions for ADHD almost like filling in pieces to a puzzle. It's going to be different for everybody. We want to keep adding things until it feels like we have everything covered that we need to cover. But the medication does tend to be one of the bigger pieces, and that's not because we're trying to medicate a generation, and it's not because of the pharmaceutical industry. It's really just the research shows that that's extremely supportive because ADHD is a medical disorder for many children and adults with ADHD, as long as they're used well. Even within that, they tend to be more specific for only parts of ADHD. They tend to be more specific for the kind of old school view of ADHD. They help more with focus, hyperactivity, impulsiveness than other parts of ADHD. Um, but they, but that's the bottom line is I don't think it's fair to parents that they're thought about differently than other pediatric medicines. Don't use any medicine you don't need in life. That's always the
Mm,
better option if you can get away with it for anything in
absolutely.
life. But it's
Mhm.
unfair to that parents are made to fear these medicines more than other medicines either. It's a hard enough decision without the extra. So don't use medicines you don't need, but you don't have to be particularly going out of your way to avoid these medicines if your child does need them.
Okay. Thank you for saying that to us. I mean, that's a big relief for all of us. At the same time, what should be the exact position or symptom a parent noticing so that they should definitely go and see for a medicine? They should definitely go for a medicine. I mean, no other option but medicine. Is there any symptom in ADHD children?
No,
Not
there's no single
exactly.
symptoms you'd be looking for. It's a judgment call of just, have it's a totally individual decision to me. I always try to collaborate in that kind of decision making. It has to do with how significant the impact is, how long you've been living with it, what other interventions you've tried or haven't tried, and just how much struggle someone's going through. So
Okay.
I think it's a totally individual decision, that's best made through kind of having an objective view of what's possible or not possible because of the medications. But I wouldn't want to put it in the box and say it must be at this point. I think it's up, it's up to most families, and the most important thing is to try to just approach it objectively, and meaning that there's a lot of misinformation out there, and no one should be pushing you to be using them, but no one should be pushing you not to be using them. And then just, depending on your own child and situation, again, the US recommendation is pretty straightforward. I don't always follow it linearly, but it's that in any school age child, there's a pretty low threshold for starting medications early. Um, I think most people would prefer to take it more step by step than that. And yet it is important to understand that that recommendation is based in the research. I mean, there's a reason that recommendation exists.
Okay. Okay. So, what can be like the side effect or causes if early interventions are not done?
That's a great question. The side effects of ADHD itself. I mean, basically, there is a growing body of research that, if anything, has shown undertreated, undermanaged ADHD has even more impact on life than we used to know. So that ADHD is often seen as primarily a school condition, but it's actually much bigger than that.
Okay.
So you need executive function to manage almost any part of life. And undertreated
Absolutely.
ADHD has been shown to affect school for sure, but also in other children or in many children, it affects their social life. It can affect their self-image. It puts kids at risk for accidents. It affects
Mm-hmm.
driving. It's very closely linked to substance abuse. Undertreated or not treated ADHD is linked to when kids get older. And there's a big body of research from Russell Barkley, or a big study from Russell Barkley that came out. I don't remember exactly when, right before the pandemic, that actually linked ADHD to poor health outcomes in life because ADHD executive function is the skill set used to sustain healthy living. So that it's not that ADHD directly affects your health, but what it does do is it directly impacts sleeping and eating and exercise habits and drinking and all these other things that cumulatively can affect your overall health.
Okay.
So, as much as I don't want to overwhelm anyone, but that is what the research shows. And I don't think it means everyone is by any means doomed with ADHD. It just is really just a way of saying that we don't want to avoid thinking about ADHD because the more comprehensively you treat it as early as possible, the better off kids and teenagers are going to be.
Okay. Thank you. And I want to keep it really short. And just one last
Uh,
question: how to manage
sure.
ADHD in children? Give us few tips, like what important tips for my viewers.
For how to manage it in children, is that what you said?
Yes, yes. How to
Um,
manage
that's
ADHD
a
children. I mean,
huge question,
few
but I'll try
tips.
to give you. I'll give you the shortest version I have. I'll try to think of it. I could think about it probably in two parts, the shortest version. I think
Okay.
one really important step towards meeting a child where they are developmentally before you move forward with actual interventions is educate yourself about what executive function is, and then try to recognize that kids with ADHD are really behind in a skill set. It may seem that they don't care or they're not being motivated or they're being difficult. All these ways it's mislabeled because
Okay.
really what they're struggling with is, there's that great one-line description of ADHD that it's not a disorder of not knowing what to do. It, it's a disorder of not doing what you know. The information's
Okay.
in there, but they're mismanaging situations. So if as a parent you can begin to understand executive function, that's very supportive both for your own well-being and your child's. Like, for example, people with ADHD often have a hard time shifting attention. This is just an example of a very concrete thing that comes up when you understand executive function. So if somebody with ADHD is very almost hyper focused on doing what they're doing, and you ask them to do something else, they're not going to be able to even register the question. It often leads to an escalation. It seems like they're being difficult, when really, in the end, it's just a challenging part of executive function. And once you understand it that way, you can see that you have to get their full, it's a lot of work, but you have to get their full attention first and ask your question a little differently. And through that, you might get better compliance and you might communicate more easily, and everyone will feel more successful. And there's 1,000 other ways understanding executive function alone helps you manage ADHD. In terms of the actual intervention, if you want me to keep it short, I'll just outline what it usually looks like, which is to say that I usually break my thinking into four parts of life. Um, in school, we have to have a school plan in place that acknowledges someone may be totally trying hard and totally academically skilled, but struggling with executive function, organization, planning, time, and all that. So they will benefit from recommendations and supports in the school setting.
Okay.
The second piece of things is that schools actually don't often do the kind of core of the non-medical intervention for ADHD, which is how do you develop social, emotional, and executive function skills when you have ADHD. So outside of
Mhm.
school, kids often benefit from things like coaching or cognitive behavioral therapy, or parents doing parent training so that they can help manage ADHD. So the second piece are sort of the non-medical things that need to go on outside of school for many families. I'm not saying everyone needs all of this. These are just your different options. The third piece is that health piece I mentioned a moment ago. So that I think kids with ADHD, it's important to stay on top of eating and sleeping and exercise and screen time and all those things are the third part of ADHD management to consider. And then the last one is the medication decision. And like some combination, pulling from those four sets of interventions will help you get on top of ADHD over time. And it might change over time. In some years, you might need more than of one, and some years a different one. But that would be, my general thought for how to organize your thinking in terms of managing ADHD. I do think it's a more complicated chronic condition than many people anticipate, which is why it's hard to summarize, very quickly how you would do an intervention. I guess I would just end though, because it's sort of how you led into things. It's worth mentioning one of the more unique challenges of ADHD in terms of the concept of collaborating with children with ADHD, which is executive function skills are the ones you use in order to plan and manage through a difficult challenge. So very uniquely with ADHD, kids with ADHD, even adults with ADHD, are often struggling with the exact skill set they would use to overcome that struggle. It's a very challenging cycle. So that children with ADHD have a planning disorder. So the plans they make, even to manage their own ADHD, are harder because they have ADHD in the first place. All of which is to say that, it really does rely on adults and parents first quite often. It's not a motivational issue. It's that they're actually behind in the skills, and we need to actually teach them skills that are going to one day get them to the place where they can more independently manage their ADHD themselves.
Okay, that was a very useful one. Thank you for sharing everything with us. And I want all my viewers to go and reach out to Dr. Mark Bertin through his website, which I'll be putting in the description box. Thank you, Dr. Mark Bertin, for being here with us.
Well, thank you so much for the invitation. Take care.